So now we're going to discuss the normal blood pressures within the heart. So how do we measure to see if the pressures are normal to begin with? Well, we have several invasive techniques that can be used to measure blood pressures within the heart, specifically the Swan-Ganz catheter. Now this is a catheter that enters through a systemic vein, generally the internal jugular vein. It passes through the right atrium, into the right ventricle, and up to the capillaries of the pulmonary artery. You can see here is an image of the Swan-Ganz catheter. It's placed in through the right internal jugular vein, goes in past the SVC into the right ventricle, out through the pulmonary artery, and wedges itself, as they call it, into the pulmonary artery capillary bed. The pulmonary capillary wedge pressure, measured by the Swan-Ganz catheter, is a surrogate measure of the left atrial pressure, because in theory, the pulmonary artery capillaries are considered continuous with the pulmonary vein that drains into the left atrium. So it's not exactly the left atrial pressure, but it's a diagnostic marker or a surrogate marker of the left atrial pressure. Now let's get over the generally accepted or the most common pressures within each chamber of the heart. The right atrium has the lowest pressure of the rest of the cardiac system, and really it is continuous with the severe vena cava and the inferior vena cava. The pressure is about 5 millimeters of mercury or less. If we see it higher than that, then we get worried about pulmonary hypertension or right ventricular dysfunction. Blood then flows into the right ventricle, and we can see here that there is a systolic and a diastolic number given, and that makes sense because the ventricle is going through, the right ventricle has a systole and diastole, and we see a higher blood pressure in systole of 25 and a lower blood pressure of 5 in diastole. And this kind of shows you in comparison to our left ventricle just how weak the right ventricle is. It produces much less pressure and it's a much smaller muscle mass, and therefore the pressure is much more reduced than the left ventricle. During right ventricular systole, the blood is pumped into the pulmonary artery, and we can see that the systolic pressure in the pulmonary artery is equivalent to that of the right ventricle. That's essentially sort of a continuous circuit where the blood pressure is the same in the pulmonary artery, ultimately going into the pulmonary vasculature, at which time it returns to the pulmonary vein and back into the left atrium. It's important to remember that the right atrium reflects the central venous pressure because there are no valves between the systemic veins in the right atrium, as I mentioned earlier. So when we measure the central venous pressure, we are essentially measuring the right atrial pressure to give us an idea of how well the heart is pumping forward. Left atrial pressure is generally less than 12, and this is an important pressure that we can measure, and we measure that through the pulmonary capillary wedge pressure and the Swan-Ganz catheter. And this gives us an idea of how well our left ventricle is functioning or how well our mitral valve is. In the setting of mitral stenosis, we see a narrow stenotic mitral valve. We see a buildup of blood proximal to the valve. We see an increase in left atrial pressure. In left ventricular dysfunction, heart failure for instance, we know that the blood is not as effectively ejected from the left ventricle. We see buildup back into the left atrium. We see an increase in left atrial pressure as a result of left ventricular dysfunction. So when we put in a pulmonary capillary wedge pressure monitor, the Swan-Ganz catheter, we're really trying to understand how well is our left ventricle working, how well is blood flowing forward, and is there something we need to worry about, whether it's the mitral valve or the left ventricle. So those are the key measurements and the key normal cardiac pressures that you should be aware of when you're taking your exam. They might give you a situation where the left atrial pressure is 20, and the patient has shortness of breath and edematous lower extremities and jugular venous distension, and they're going to want you to reach a conclusion that this patient may have left ventricular dysfunction. So these are some important pressures that you should be sort of familiar with so that you are able to use the information and apply it on your Step 1 exam.